Okay,
All right. Good morning. It is Wednesday, January 5th, and this is a joint meeting with House Healthcare and Senate Health and Welfare. I'm Senator Ginny Lyons, Chair of Health and Welfare, the Health and Welfare Committee in the Senate, and
I'm Representative Bill Lippert. I'm Chair of the House Healthcare Committee.
so before we begin the meeting, I think it's important that folks who are here with us, as well as those of you out in the YouTube world, meet our committee assistants. So just briefly, Aaron, would you mind introducing yourself? And then Claire will have you introduce yourself.
Yeah, hello everyone. I'm Aaron Zenamer. I'm the committee assistant for Senate Health and Welfare. If you have any questions, feel free to contact me. My email is on the committee webpage.
Claire?
I'm the committee assistant for the House Committee on Healthcare. And same as Aaron, if you have any questions, feel free to contact me. My email is on the committee webpage, and I'm looking forward to working with you.
Thank you both. We're actually very thrilled that you are here with us. It's been, as we said yesterday, it's been some time since we had a committee assistant, so it's good to have you working by our side. So thank you.
Can I just also say
Yep.
that it's important for witnesses who may be listening or who are anticipating being witnesses in our committees to make contact with our committee assistants so that they have your correct contact information ahead of time, especially during this remote period, but throughout the session. Many contacts have, things change, and Claire and Aaron will be running to catch up with all the changes, but help us out by being in touch on a proactive basis. Thank you.
Okay, so thank you, and thank you all for being here today, all the witnesses who have gotten online. The pandemic has put us all in a very difficult position, and we worked with many folks last year to ensure that our healthcare world could continue functioning adequately. And so today we're going to go through Act 6 first, and Jen Carby is here to explain to us what Act 6 is and what it did. And I think as we're listening and as we listen to those who are testifying, it's really important that we, as legislators, sort out how we can help keeping the healthcare system moving forward during this latest surge. So look for things that we can continue, and maybe there are suggestions for additional legislative remedies. So Jen, Bill, did you want to say anything at this point?
No,
Representative Lippert.
it's fine. I think it's important for us to, as I was saying to our committee, and I'm sure you as well, that in order to provide the possibility of continuity, we need to take, this is at the top of our agendas for both of our committees as we come back into session here in January. And one of the things that would be important, I think Jen will make clear to us, is that what the time frame is for the current authorization and what it means to move something potentially through both our bodies into the governor's desk to provide that continuity.
Yeah, thank you for that reminder. I think that's really critically important, and whatever we do, we want to give our respective committees sufficient time for decision making, and we know it's going to be a short time frame. So.
Right.
Jen, why don't we turn it over to you?
Great. Good morning and welcome back. I'm Jennifer Carby from the Office of Legislative Counsel. And I think you have received, maybe by email and also posted on the committee web pages, I've updated the chart that we looked at last year that has the time limited provisions related to COVID-19 flexibility that were in first Act 91 of 2020, extended in Act 140 of that year, and then extended again in 2021's Act 6. And so I've updated those to reflect changes, and particularly any information on the updated expiration dates so that you can review those. So I will put up that document and we can walk through it. So you should be able to see that document now. So I'll just take you through these provisions. The first one is a directive to the Agency of Human Services to consider modifying existing rules or adopting emergency rules to protect access to healthcare services, long-term services and supports, and other public services, and to consider the importance of the financial viability of providers that rely on public funding. This had initially been enacted to be effective during the COVID-19 state of emergency. The most recent extension has this provision in effect through March 31st of this year. So you'll see many of these expire on March 31st. The second one is a provision allowing the AHS secretary to modify hospital provider taxes and waive or modify other provider taxes if that action is necessary to enable those providers to continue offering their services, and the secretary gets the approval of the Joint Fiscal Committee and in some cases the Emergency Board. From what I can tell, this provision has now expired. It was valid during the state of emergency and for 6 months afterward, and Vermont's state of emergency expired or terminated on June 15th of 2021, making 6 months after that, December 15th of 2021. So you would potentially need to look at reenacting this if you wanted to continue that flexibility. The next section deals with a requirement that all healthcare facilities and human services providers follow guidance from the Department of Health on measures to address employee safety. And this was specifically designed to protect non-healthcare professional employees who might be working in a healthcare setting. This one expires or is valid through March 31st of this year. The next is a provision allowing the Secretary of Human Services to waive or permit variances from the agency's healthcare and human services provider rules as necessary for specific purposes, prioritizing and maximizing direct patient care, supporting children and families who receive benefits and services from DCF, and allowing for continuation of operations with a reduced workforce and flexible staffing arrangements. This again is valid through March 31st, 2022. The next section, originally from Act 91, allowed the Green Mountain Care Board to waive or permit variances from laws, guidance, and standards on certain areas that they regulate: hospital budget review, certificates of need, health insurance rate review, and accountable care organization certification and budget review as needed in order to prioritize and maximize direct patient care, safeguard healthcare provider stability, and allow for an orderly regulatory process that's responsive to evolving COVID-related needs. Again, this provision appears to have expired because it was valid during the state of emergency and for 6 months afterward. So you may want to consider whether that's something you want to put in place again. The next section requires the Department of Vermont Health Access to relax Medicaid provider enrollment requirements and the Department of Financial Regulation to direct health insurers to relax their plans' provider credentialing requirements to allow providers to deliver and be reimbursed for services across healthcare settings as needed to respond to evolving needs. This had a few different expiration dates, but the current one is until March 31st, 2022. The next was a provision that allowed the courts and the Department of Mental Health to waive financial penalties if a treating provider failed to comply with certain documentation and reporting requirements for involuntary treatment. This was only valid during the COVID-19 state of emergency, so it is not currently in effect. The next section, which has been amended an additional time in the past 2 years, directs Department of Financial Regulation to consider adopting and allows it to adopt emergency rules, first to expand health insurance coverage for and waive or limit cost sharing requirements directly related to COVID-19 diagnosis, treatment, and prevention. Also to modify or suspend health insurance plan deductible requirements for prescription drugs. And then the one that struck through dealt with expanding patients' access to and providers' reimbursement for services delivered remotely through telehealth, audio-only telephone, and brief telecommunication services. This had been deleted in Act 6 of last year in light of the coverage requirement for audio-only telephone that was also enacted in that same act. But you did add a provision specifically addressing health insurance coverage of and reimbursement for telephone triage services. That seemed to be the one piece that was not covered by either existing law on telehealth or the new law on audio-only coverage. And that authority for DFR for the emergency rules is valid through March 31st of this year. The next section requires health insurance plans and Medicaid to allow their members to refill prescriptions for chronic maintenance medications early so that they can keep a 30-day supply of their medications at home. This is in effect through March 31st of this year. The next section allows pharmacists to extend a previous prescription for maintenance medication if the patient doesn't have any refills left, or if the refill authorization recently expired and it is not feasible to get a new prescription or more refills when the prescriber requires the pharmacist to notify the prescriber of the extension. And that is no longer in effect. The last extension of that was through June 30th of 2021. The next section allowed pharmacists with a patient's informed consent to substitute an available prescription drug for something that was unavailable in the same therapeutic class if the available drug would have substantially equivalent therapeutic effect, even though it's not an actual therapeutic equivalent drug, and again, with notification to the prescriber. That one expired in March of last year. So you chose last year not to extend these two provisions. The next section allows a healthcare professional to authorize renewal of an existing buprenorphine prescription without requiring an office visit. This one is in effect through this March 31st. The next section allows the Agency of Human Services to reimburse Medicaid-funded long-term care facilities and other programs that provide 24-hour-a-day services for their bed hold days, the days that they have to hold the bed while the patient may be, or resident may be somewhere else, like a hospital. This one was extended through March 31st of this year. The next few sections deal with healthcare professional licensure. So this deems a healthcare professional who is licensed, certified, or registered to provide healthcare services in any other US jurisdiction as being licensed, certified, or registered to provide services to patients in Vermont using, initially it was just using telehealth or as part of the staff of a licensed facility. Act 6 also added providing services as a volunteer member of the Medical Reserve Corps or as part of the staff of a federally qualified health center. And the language requires out-of-state healthcare professionals who plan to provide services in Vermont as part of the staff of a licensed facility to submit their information to the Board of Medical Practice or Office of Professional Regulation. That is in effect through March 31st of this year. The next section allows a former healthcare professional who retired from practice or went inactive not more than 3 years ago to provide healthcare services to patients in Vermont by telehealth or as part of the staff of a licensed facility. And then again, Act 6 added this volunteer as a volunteer member of the Medical Reserve Corps or as part of the staff of an FQHC. So they can provide services to patients in Vermont after submitting their information to the Board of Medical Practice or Office of Professional Regulation. It also authorizes OPR and the Board of Medical Practice to issue free temporary licenses to former healthcare professionals who retired or went inactive between 3 and 10 years ago, with the potential to impose limitations on their scope of practice. These provisions are in effect through March 31st of this year. The next section allows, if the director of OPR or the executive director of the Board of Medical Practice finds that their boards cannot reasonably, safely, and expeditiously convene a quorum in order to meet, that the director or executive director may exercise the full powers and authorities of their respective boards, including disciplinary authority, and records of their actions would need to be posted on the relevant website. This provision is in effect through March 31st of this year. The next section allows the director of OPR and the commissioner of health to issue orders governing regulatory professional activities and practices as needed to protect public health, safety, and welfare. This one is also in effect through March 31st of this year. We're almost done. The next section, now leaving the area of healthcare professional regulation, this section specifies that it is not to be considered the emergency involuntary procedure of seclusion for a voluntary patient or an involuntary patient in the care and custody of the Commissioner of Mental Health to be placed in quarantine if they've been exposed to COVID-19 or in isolation if they have tested positive for COVID-19. And it has similar provisions saying it is not seclusion for a child in a residential treatment facility to be placed in quarantine if they've been exposed to COVID-19 or in isolation if they've tested positive. This is not a time-limited provision per se. The language doesn't limit it, but it is specific to COVID-19 exposures and positive tests. So in that sense, it is tied to the current pandemic. The next section allows a waiver of certain telehealth requirements relating to HIPAA compliant connections if it is not practicable to use the connection under the circumstances. That one is in effect through March 31st, 2022. You added language in Act 6 of 2021, also saying that for 60 days following a declared state of emergency, there can be a waiver of informed consent requirements if it's not practicable to obtain or document informed consent under the circumstances. So the HIPAA compliant connection is a specific time limited provision. The other is only in effect during and after, for 60 days after a state of emergency. The next section allowed the Office of Professional Regulation to issue a temporary license to a graduate of an approved education program for a board or profession attached to the office if the licensing examination required for the profession was not reasonably available. This expired. It was only valid through March 31st of 2021. But the next section allows the Board of Medical Practice or its executive director to issue to an individual who's licensed as a physician, physician assistant, or podiatrist in another jurisdiction, a temporary license to practice in Vermont until, it should have been extended, until not later than April 1st, 2022, because that is valid through March 31st, 2022. And it specifies that the board or its executive director can waive certain requirements, including scope of practice requirements for physician assistants. Last two sections here. The next one is a sunset on the pharmacist's authority to order or administer COVID tests pursuant to a state protocol approved by the Commissioner of Health. And you extended this one, so that extended the sunset on this until March 31st of 2022. So pharmacists can continue to order or administer COVID tests until March 31st, 2022. And finally, you extended the authorization for remote witnesses and explainers for advanced directives. This is an issue originally taken up in the House Human Services Committee and in Senate Health and Welfare, and that extension runs through June 30th of 2022. So I will take that down, but happy to answer any questions.
Questions of clarification? Representative Cordes.
Thank you, Council, for going through that. A couple clarifying questions.
Sure.
one clarifying question and then one general question. On the section about renewal of buprenorphine not requiring an office visit, what's the definition of office visit, and does it include telehealth, telemedicine?
No, I don't believe it includes telehealth. I think that's what was being authorized, was not requiring an in-person office visit. At least that's the way I understand it. The language did not specify or did not provide a definition of an office visit. So those in the provider community may be able to provide more insight into that. But I think in general, they do require a visit to the provider's office. And that was what was being suspended.
Okay, thank you. And the second one is in the areas that refer to following guidance from the Department of Health. This is a general question that maybe we need to discuss, but I'm wondering if it would be possible to add CDC to that, so it's not just the Department of Health, but that we have the option to use the guidance of the CDC.
Was there, I'm not recalling
Can
a
you
particular.
direct us to the specific
provision.
reference that you're
Yeah.
making?
Yes.
The guidance is pretty early.
So the third row down, and it starts, the summary of provision starts with to protect non-healthcare professional employees from
I gotcha.
COVID-19.
Yeah.
And in any
Thank
other
you.
area where it might contain that statement requiring to follow guidance from the Department of Health, adding CDC.
That is a good suggestion to be made for both committees to look at and listen to the testimony. It's good. There's another section that kind of relates to that, where the OPR or the Commissioner of Health can provide, may issue orders regarding regulatory professional activities and practices as needed to protect public health, safety and welfare. Is slightly different. It's on the bottom of page 3, but may be related. It's really about regulatory.
That's in the
Yeah.
scope of their professional regulatory authority. So,
Right.
you may want to hear from the Department of Health, but I would presume that the rationale for
OPR.
their,
Yeah.
right, the rationale
Yeah.
for their exercise of that regulatory authority may relate to their understanding of CDC recommendations as well.
Any other questions, Representative Cordes?
I'm all set. Thank you very much.
Okay, Representative Goldman.
Good morning and thank you. I'm wondering so after 2 years, a lot of these things are sunset, they have expiration dates. Have we learned that maybe some of these things don't necessarily need to sunset? So I was thinking about bed hold days and remote witnesses, just as an example, as explainer for advanced directives, that maybe everything doesn't need to be sunsetted and that it could just be ongoing. And that's what I was wondering, if what we've learned that we want to embed.
So that's a very good question, and hopefully our witnesses will help us understand the benefit of what we've done or whether or not they should continue.
And we may find that we need to take additional testimony from additional witnesses once after we do our overview today to speak to that issue specifically.
Thank you.
Senator Hardy. Oh, wait, Representative Goldman, was that?
That
did
was
you
a
have-
thank you.
Oh, okay. Senator Hardy.
Thank you, Senator Lyons. Sort of along those lines of what we might want to extend or getting other testimony, as Representative Lippert said, I was, as Jen was going through this list, I was remembering a conversation I had with my designated agencies a designated agency about some flexibility that they are seeking that we may want to get some testimony on and potentially add to our list. And I dug out the email from them, but it's related to an assessment requirement and added work that they're experiencing under their short staffing situation with COVID, and wondering if we could get Julie Tessler in to testify about that issue. Because
So
I
that
think our
we'll
are
have,
under a lot of pressure, and we don't seem to have much about them on our list.
we will add that to our work. I don't know how much I guess you also, Representative Lippert, deal with the DAs,
Oh, yeah.
but
Absolutely.
so-
That's our jurisdiction.
and okay, so we'll certainly, as you think of these other folks to testify, this will be important. You can send those along to, in the case of the Senate, send it to me, send it and to Aaron, and then Representative Lippert and Claire.
Right.
Great, thank you.
That's great.
Mm.
Any other, go ahead, Bill.
May I
Representative
also,
Lippert.
I also want to note that there are, while we're having this joint meeting between our two committees, in the House Human Services Committee has weighed in and was helpful in several of the particular provisions of this, whereas your committee has jurisdiction over what is pretty much covered by our two committees in the House. We in the House will want to involve the House Human Services Committee in reviewing several of the provisions that are specific to areas of their jurisdiction having to do with child facilities and several other points. But we're not having the three-way joint committee meeting today because most of the provisions are between our two committees. But we in the House will want to bring them into this conversation as appropriate.
That's terrific. Thank you. Any other questions?
I do have, I would defer to hear from others first, but or further, but I do have one other question as we're going through this, and I'm looking, I lost it on my screen here, but I think it has to do with the Green Mountain Care Board. And Jen, it talked about the expiration at the end of the emergency and for 6 months following. I have to say, I'm not quick enough to do the calculation in my head as to when and how that authorization terminated. Does anybody have that? And
So yes, the state of emergency ended on June 15th. So the 6 months after that is December 15th.
okay, so that has expired then.
That
as
has
of December
expired.
15th. I would
Right.
like us to hear from the Green Mountain Care Board and others involved in that as to whether there should be some further extension of the flexibility that was granted to the Green Mountain Care Board and those involved in those reviews.
But that was on my list of questions as well. So
Good.
we killed two birds with one stone.
Okay.
I am going to ask one other, do you have another question?
No, that was the particular one I wanted to flag.
I'm
see.
just going to, I think when we have the Board of Professional Regulation with David Herlihy in, would be interesting to ask the question about Canadian providers and extending some, whether or not Canadian providers could be temporarily licensed for practice, regardless of who they are. I mean, it could be nurses or physicians or whatever. So, and perhaps I'm looking at Lauren shaking her head. Maybe we can hear something about that going forward. Senator Hooker.
Thank you. I'm just looking along those lines about allowing retirees to continue to offer telehealth services for a longer period of time. It seems to be limited to March 31st. And the second thing that I was looking at and would like more information on is what will we do about expanding health insurance coverage and waiving costs for COVID-related diagnoses as time goes on. So would just like more information on those two pieces. Thanks.
Part of that will go to the insurance world and DFR, and part of that will go to DIVA. So, and Jen, you can help us with other critical input. Senator Hooker, any other questions? Okay. Representative Donahue.
Thank you again for what we look at as we move ahead. I think in some of the areas, if, for example, providers are asking for an extension, I think it'll be important to hear whether waivers were ever actually given and what they were for, so that we have a sense of specific examples now that it's gone for a couple of years. It struck me on that on the AHS secretary's ability to give waivers of provider rules, and actually hearing whether that was used and in what ways, so that we have a better sense of what is being authorized or not authorized.
Yeah, that's a good question, and it may actually relate to the earlier question from Senator Hardy regarding DAs. So see whether that was thought of, whether the request was made. So important. Senator Cummings, and then Representative Peterson.
Yeah, I think along the lines with Representative Donahue, it would be helpful to know how many of these waivers we've done, what has been the impact, what would be the impact if we didn't extend it, what are the risks? I mean, there's retired people and there's retired people. Do you have to do continuing education? Do you have to, how many years have you been retired? I'd like to know. I'd like to be able to balance the pros and cons on this one.
Okay. Representative Peterson.
Yes, thank you, Senator. I wonder how many of these various, in this various list, there's a cost component to both short-term and long-term. It'd be good to know what impact continuing with these does to budget, does to the long-term health of certain agencies, and anything like that. I'd like to be able to weigh that cost against the benefit we're going to get.
Good question. Okay. Any other questions or comments? Representative Lippert.
Well, I'll raise a broad question, and I appreciate all the specifics that people are surfacing and all of which we need to look at. The broad question I have is, if we extend some of these provisions, which I believe we probably will recommend that some of them are extended, what is the extension? What is the period of extension that we should be considering? Given that, given the circumstance we're in now, and knowing that we made some decisions to extend these provisions through March 31st for the most part, in order for us to come back and do what we're doing right now, which was being able to not have things, for the most part, abruptly end before the legislature was able to reconsider possible extensions or no possible extensions. And so that's it's a broad question, but I think it's an important one that I will be interested in hearing from witnesses about and hearing our deliberations together.
Well, I think that's a great question. And, we probably could evaluate each one of these as to the cost benefit ratio different for quality and for resources. But I think one of our concerns with these issues is the time frame that we have to complete our work. So as we go through,
Right.
there may be things that we extend for a period of time, but we want to come back to for a fuller evaluation. And then there may be some things that we extend, and let's not go any further with those. And then also keeping in mind, I mean, this gets complicated quickly. This is a pandemic related set of recommendations. So there's a lot going on there. We don't want to prolong the agony, so to speak. And we could do that. We could evaluate each one of these.
Yeah, we're going to need to balance all this.
We
But
don't want to go down the rabbit hole, but so,
Right.
yeah, I get it.
there's something to be said for having some clarity about what many extensions are. But I just pose it out there because I don't think there's been an answer at this point. And maybe some of the testimony today will actually provide us with some of those suggestions, but it's something which I think we need to be thinking about.
Yes, excellent. Representative Cordes, did you have your hand up?
I did, Madam Chair, thank you. I appreciate what both of the chairs are saying, and yes, it would be challenging to go down the rabbit hole. And I think we're in, for unfortunate reasons, a unique moment to reset some of our healthcare policies and aspects of our healthcare system that the pandemic painfully highlighted needed change. So I hope we also will be holding that framework as we look at this. And I understand we have quite a large amount of work to do, but I want to keep that framework active in our minds.
I completely agree with you. And it may be that there are some of these provisions that we want to have a fuller evaluation about, and we can ask for that. We could, perhaps it's through some of the folks who are testifying or through Joint Fiscal Office or some of our departments. So I think you're right. We need to keep moving forward on some of these things that have closed some very important, expose some gaps.
Right.
All right, any other questions? All right, so now we can hear from Lauren Hibbert. And Lauren, we're looking forward to your testimony. I know you did send out some information to us, and I think we have it on our webpage.
Great. Good morning. For the record, my name is Lauren Hibbert. I'm the Director of the Office of Professional Regulation under the Secretary of State's office. I'm not planning to screen share my testimony, and I think probably for purposes of clarity, I'll refer to Legislative Counsel Jen Carby's document for sections, just because I think it's confusing. If this is a complicated, Act 6 is complicated, and it's four mothers of Act 90 and Act 40, Act 91 and Act 40 are complicated. So I'll just refer to Jen's document if that works for all of you. I just wanted to first and foremost say thank you. It's great to see you all. Happy New Year. It's been quite a time since we've seen you. So thank you for having me. And, anytime we talk about Act 6, I always just want to extend my deep gratitude to both of these committees for the work that you did on all of these bills. I think they've been extremely helpful, specifically for OPR to be a good partner during the COVID pandemic. It's enabled us to license people who otherwise would not have been able to be licensed. We had so many people whose exams were disrupted, who had graduated from master's programs and could not enter the workforce. And then we were able to license them while they were waiting for the exams to come on board. We've been able to enable out-of-state folks to provide telehealth, to work in our facilities with some of the powers that these bills have given the office. I've been able to write regulatory orders to stop truly dangerous behavior. So it really should not, it would be a failure to mention just what significant work this is. And I do recommend extension of the majority, if not all, of the Act 6 provisions that go through the end of March of this year. And to Representative Lippert's question, I recommend that the majority of them extend to March of 2023. And the reason is exactly what we're doing right now is if these expire, and we're in a situation where cases are skyrocketing and the healthcare workforce is in crisis, which I think, it honestly is at this point. If we're in that situation in October of this year and the legislature is not in session and that's when these provisions expire, then I think we're setting a lot of institutions, a lot of individuals, a lot of patients up for failure. And I just want to be careful that we're not doing that. And so I recommend March of 2023. The sections that I particularly wanted to highlight are section 17 of Act 90, which is on Jen's page 3 of her summary. And this is the section that deems that healthcare professionals who are licensed, certified, or registered to provide healthcare services in another US jurisdiction, and footnote there to talk about the Canadian workforce, are deemed licensed or certified to provide healthcare services to patients in Vermont using either telehealth or as part of a staff of a licensed facility. And Act 6 included a volunteer member of the Medical Reserve Corps. So there's really 3 parts to this section. 1 is telehealth, 2 is in a facility, and 3 is Medical Reserve Corps. With respect to telehealth, I know our subsequent hearing will be on the Act 21 recommendations that the office has been working on. I recommend that we move forward on those recommendations and not extend the telehealth. Although it may be prudent, depending on timing, to have the Act 6 provisions continued for a period of time until the Act 21 recommendations can go into effect. And that's some strategic drafting that I hope that I have the opportunity to talk to Jen with and with the rest of you with, and some logistical questions that I don't have all the answers for. In terms of people who are working in Vermont facilities, I do support extending the Act 6 91 140 provisions, allowing someone who is licensed in another state to practice in our state. This does require that they register with our office. I think that is important. I would like to see that continued. I would be interested in considering some constraints on how long somebody can be practicing without a license in Vermont. And that's something that I have talked with the healthcare associations about. We've had 2 very productive conversations since last week, including one this morning. So I think there can be consensus here around what that constriction would be. I am a regulator. I like to know who's working in Vermont. I like patients to know who's working in Vermont. And I also think that the state should have appropriate regulatory control over people who work in Vermont. So that's the tension. I also want to make sure that facilities are able to fill critical shortages. I understand that facilities are needing to bring people in to the state on a day's notice. I want to be respectful of that urgent need. So that's the tension. With the Medical Reserve Corps, those folks are truly volunteers. I don't see a need to have that same restriction on how long they can be serving in that function while on the Medical Reserve Corps team. So that's just the piece that I wanted to highlight there. The other really important sections from OPR's perspective to continue would be the emergency authority for the director to act for the boards. We have had quorum issues. I think we will continue to have quorum issues. Healthcare providers who serve on our boards are really strained right now. They frequently cannot take time away from their work to serve on boards, or they're having COVID ramifications. I have not utilized this authority for quite some time, I think since the beginning of the summer, but I would be concerned if it just disappeared given what we're foreseeing. Another important section is the emergency regulatory orders. Again, I have not used this section for quite some time. I think my last one was in the spring of 2021, but those have been extremely helpful. We have needed to utilize those. To the question about whether we rely on CDC guidance, yes, we have. We've relied on CDC guidance. We've relied on ACCD guidance. We've relied on Department of Health guidance. We've looked at really what's the essential standard for the practice at the time. So I don't know if we need to include all of those references into the statute, but I wouldn't want it to be an exhaustive list or an exclusive list. But what we have done is we've grounded those regulatory orders as telling the professional that their practice falls outside of the standard and acceptable prevailing standard of practice, and that the acceptable and prevailing standard of practice is based on guidance from the CDC, from Department of Health, and at many times from ACCD, which was offering guidance to professions on what they should be doing to operate throughout the state of emergency. So that has been helpful. The other piece that is important is extending pharmacists' authority to order and administer COVID tests. That is currently being done all the time, as I'm sure many of you have experienced personally, or your constituents have. That is being done both through this legislation and through an expansion of the Federal PrEP Act, which authorized pharmacists to order COVID tests and to administer vaccinations. But I think it's really important to extend here in Vermont, even though the PrEP Act has allowed it, because the federal government could restrict the PrEP Act in some way that we can't foresee. And a lot of Vermont's approach to providing access to Vermonters has been through pharmacist services. That's been a key component, and I think it is important to continue. So those are the sections that I think are really important. I encourage you to think about March of 2023. And again, I'm just deeply grateful for this work. Vermont's been on the forefront with the COVID provisions. I've talked to other states and been in conferences about this issue. We've been looked at as an example, and you all should feel very proud of your work. And I'm very proud to have been able to work with you on it. So thank you.
Good. Thank you very much. Your last comment about Vermont being ahead and leaders in this area is actually a great tribute to the work that you've done, as well as others. And we value the input that you've given us. So I do. So thank you. Just wanted to say that.
Absolutely.
And just I'll have one question, and I know others will have questions. And this is the first opportunity we've had to hear from you, and we have the list from you that we'll probably have to dive into a little deeper as we go forward. You indicate March 2023 based on what we know and what we're seeing. And yeah, I keep reading about the modeling for the future, and I'm sure you're doing the same thing. So as we go through this, it would be helpful to know what is the data that you're using to, how are you basing that decision? Last year, I think we all heard fall surge, and we were ready for the March 22. So now we need to have some justification going forward. So, but thank you.
Absolutely.
Sincerely.
Thank you.
All right. I saw another hand up.
I think Representative Cordes has her hand up.
There she is.
Thank you so much for your thoughts and recommendations. And I just want to be clear that I know very well that OPR, you, and all of the folks working on these issues have been using a wealth of information. And my concern was that the language did seem exclusive about the using guidelines from one agency. And as we have seen in the pandemic, there are, because of the nature of science and the pandemic, and it being a constantly changing thing, that different agencies may interpret the same data the same way, but how to apply it a little differently. So I want to make sure that we set ourselves up to not be pigeonholed into one exclusive agency that we in law are taking guidelines from. I want to be able to do exactly what you did.
You want to be able to include the CDC as well as others.
Yes.
Yeah.
I would have no objection to that. I just wouldn't want it to be exclusive was my only concern.
Me neither.
Okay, good. We're on the same page.
Yep.
Okay. Other questions? So Lauren, you indicated that you would, you put Canada down. Do you have a comment at this point, or is that something you'd have to evaluate?
I think generally that would be something that we could support. We do our best to license Canadians as quickly and as efficiently as possible. I'd have to look at each of our programs, and I should have put this in the forefront of my testimony, but the Office of Professional Regulation regulates almost 50 professions, many of whom are health professions. We regulate the majority of the health professions in the state. So many of our health professions expressly have a path for Canadian trained individuals. We also have our new foreign credentialing rules, which we are trying to utilize to get Canadians and every other type of nationality licensed as quickly as possible. But for this deemed licensure, I'd have to look program by program to make sure that each program is somewhat substantially equivalent to Vermont's program. You know, the only concern I have is that a PT in Canada doesn't have the same training as a PT in Vermont, and that that could lead to some patient safety, although I would anticipate that that would be modulated some, because they would be on site in a Vermont facility, presumably overseen and supervised. So I think that does tip the scale to allowing Canadians who may not be substantially equivalent to a Vermont licensee to practice here. I just need to think through it a little bit, and I'd like to do that, but I'm on whole supportive of that concept and would encourage it being included.
Okay, thank you. Any other questions?
Could I just ask, Lauren, would you speak specifically to the issue of continuity? the importance of continuity in our
Yes.
in how we in the time or timeliness time frame that we act, and what are the consequences of having our decision making come right up against the expiration deadline as opposed to doing something earlier, and what
Yes.
to help us understand that more.
Yeah, I welcome that question, and I'm grateful for the opportunity to speak directly to that. And it goes a little bit to Representative Peterson's question about the operational costs put on state agencies. All of this work has been so important for all the variety of reasons that we've talked about. It also has had an administrative operational lift for my agency. There is an outreach issue. Act 6 requires me to notify all of the people in this group, some of whom I can easily identify, some I cannot easily identify, that this is expiring on March of 2021. If it's not expiring, I have then, I think, an obligation to inform people that it's not expiring. Quite a few folks are not tuned in to legislation and what's happening. So it is my role as the director of the office to make sure that people are tuned in and aware of the changing landscape. So the sooner that Act 6 is extended, the better for me as a state official to get the word out, to make sure that people know. I assume that you'll hear from the provider community that they need some assurances as well. And particularly they need assurances right now as they're dealing with, emergent staffing issues. So I think I can never say that word. I'm so sorry. The continuation is critical. And I think it dovetails with the Act 21 telehealth recommendations and the implementation of that program. It's just really critical. We know, particularly in mental health, that the mental health fields, that telehealth has been critical in handling our mental health surge. I am nervous about any cliff for telehealth in particular, and for out-of-state professionals providing care in our facilities.
Well,
All of it's just, yep, so go ahead.
Well, I would just say, in part my asking you to say more about that comes from contacts that have been made with us from constituents throughout the state, particularly around college age, college students, and continuity of access to providers, in whether they're providers out of state or they're providers in state, and then they're having to be out of state depending on what's happening on the campuses, and the access given the simply the access issues, being able to continue with a provider rather than suddenly not being able to do that and having to seek a new provider where there may not be an easy provider to find, and that knowing ahead of time is a part. Having the peace of mind is a part of the care, actually. So anyway, that's the one that's a particular issue, but I'm sure there are others, and so I'm just, again, I think we're very appropriately putting this this is day one.
Thank you.
So we're giving it a high priority in our agendas, but we need to be thoughtful and mindful that we've lots of other things, and that could suddenly, we need to not let this drop too far down the agenda if we get taken up with other issues.
Well, if I can be so bold, that's what I love about the Act 6 extension conversation, because you folks could do this and then have the other conversations that are related to some of the issues here, and access to particularly telehealth services for college age students, for mental health, was driven right to the front of the conversation of the Act 21 work. It really has expanded the diversity of providers, and we have a very diverse student base. So student populations have been able to find providers that are really appropriate for them, particularly the BIPOC students. So it's been transformational. So this work it's been excellent for COVID, but it also has been transformational on expanding access on whole. And I think we all should be careful not to lose some of those gains.
And that's the work that we have before us, and that actually is a substantiation for the extension to 2023, regardless of whether we put it in a permanent form. So that's very important. Thank you. I'm going to suggest that we move right along. We have two other folks to testify on Act 6, and then we have a full section on telehealth, and that's going to take a lot of time. So let's.
We're going to need a break between the two.
And
just
we
for our
are going
own
to
health
take a
and mental
break.
health.
Yep, we are going to take a break between the two, very short as it will be, but a break. So Jill Mazza Olson is here, and it's good to see you. Thanks for being here.
Glad to be here. Thanks. And I believe my colleague Jessa Barnard is also on the call, and I don't think I see her video on yet.
She's here.
There
Okay, good.
she is.
There she
Are
is.
you testifying together?
Yes.
Perfect.
Yes. So good morning. I'm Jill Olson. I'm the Executive Director of the VNAs of Vermont, representing home health and hospice agencies. But Jessa and I are really here today on behalf of the Provider Association Coalition. So just a reminder, it's an informal coalition of healthcare trade associations that came together back in March of 2020 when we were still in the building. And wrote many of the original provisions that we are talking about today. So with many of you, with Lauren, and I want to reiterate our appreciation for your partnership. And I also just want to really appreciate Lauren, because she's been an incredible partner through all of this. And as I think all of you know, it's worse than it's ever been today on the ground in terms of staffing. We were frankly far more hopeful a year ago than we are today. A year ago, we were implementing the vaccines to begin with, and we actually thought the state of emergency would expire, and 6 months after the state of emergency would be plenty of time for any of those provisions. That's really not quite where we are. So it's really, I don't think it's possible to overstate the stress on the ground and the need for flexibility. And even if the flexibility means one more nurse in one more place on one day, we need that. So I just want to be really clear, even things that are used sparingly are critical right now. What we're asking for broadly, I'm going to sort of give you our broad view, and then I think Jess and I will kind of tag team some of the specifics and answer your questions. But we're largely asking for you to, actually I can share my screen if I'm allowed to. Let me just do that. Oh, no, I can't yet share.
Aaron, can you let Jill Mazza Olson do screen share?
I just did that.
Great, thank you so much. I'll get there in 1 second, but I want to make sure I have the flexibility. So broadly, what we're asking for is extension of nearly all of the Act 6 provisions that are expiring on March 23rd. There are a couple of exceptions that we'll go through, but mostly we're asking for you to give us another year on all of those. Timing, for the reasons you've already talked about, March makes sense because it gives us time to come back into your process. If in a year from now we still need some of these provisions, we would not want to see them expire. First of all, we want a date certain on many of them so that people can work toward getting licenses if, say, they come back into the workforce. And two, we want to make sure that you're here if we need to have an extension. So I think the March timeframe has made sense now, I think twice, and I think it still makes sense. I want to comment that Jen's summary actually highlighted that there were a few things that expired with the state of emergency, and we actually, as a coalition, did not look back at those. And so the highlight about the Green Mountain Care Board did come up in some text exchanges. Devin Green, I think, will be joining you for your next session. I don't think she has access to the Zoom yet. But that I think is something that we'd want to see us consider. So that's not in our sheet, but thank you to Jen for going all the way back to the beginning in her summary, because it highlighted it. And I think that's it for sort of the broad comments. Let me share my screen. Jessa, did I miss anything on the kind of from the broad perspective?
Sounds great. Thanks,
Okay,
Jen.
great. Yeah, let's see. Can you see my screen?
Yes.
Okay, good. Sometimes I have failed at this. So that you have access to this. This is on your committee website, and this is a fantastic summary that Jessa did on behalf of the coalition. And you'll see how it's organized is there's the section of Act 6 that appear, and then there's the sections underneath that that are actually from the original session law. And since it's all session law, it's all these section numbers. It's not there's no statute number, so it's very hard to just keeping track of the numbers is a little challenging. So I was going to go through and just stop on a few things, but you'll see for the most part, we're recommending extension of most provisions to March 31st, 2023. So you're going to see that a lot. And I'm going to pause in a couple of places. One, I wanted to just talk about the protections, which has come up from Representative Cordes. Just we had a little bit of text exchange as that conversation was happening, and the coalition will gladly take that back and talk about it. We want to make sure that we aren't that there's enough breadth in that provision so that we don't end up not being able to comply. If you list too many things, we may sometimes there are differences between the Department of Health, the CDC, OSHA, CMS. We are dealing with employee protections actually from a variety of sources now. So we just need to make sure that you don't write language that makes it impossible for us to comply. So we will take a look at that and bring something back to you. I also wanted to pause on the authority for AHS to waive or allow variances from rules and standards. That's actually something that's been really important to home health and to others. I think it's been used very sparingly, even if at all, and the AHS could speak to that. But it's really important when we're having staffing shortages that we have flexibility for things that might take staff time, but might not be really critical in a time of real staff shortages where we've got to focus on the patient care. Also, I can say, for example, for home health, we have some obligations to that actually, when we don't have staff, there's some obligations in statute that really require us to take care of people always. And if we don't have staff, we end up sort of in a compliance situation that could be challenging. That we actually have some variances for built into the rules, but it's that kind of thing where we really need some flexibility and we want AHS to have it. I don't know about the issue that the DAs raised in Senator, I forget actually who said it now, but anyway, I don't know about that particular issue. We didn't talk about it in the coalition. Might fit under here. I'm not sure about that. So I'd have to defer to Julie on that. Julie Tesler. Scrolling down, this is where I'm probably going to need some help from Jessa. So you'll see section 17 and 18 are the flexibilities for out-of-state professionals, for the Medical Reserve Corps, for retirees. That falls into 17 and 18. We are broadly recommending that you extend them. We are, as Lauren mentioned, we are in good conversation with her about how to put a little bit of a little more restriction around out-of-state providers coming into Vermont, so that she has a comfort level that it's not sort of endless, that it's really on an emergency basis, and then people would be licensed. I think we'll come to an agreement pretty quickly on a recommendation. And then we are recommending on the telehealth that you adopt the Act 21 recommendations that you're going to talk about next. One thing I want to pause on here, last session, we home health in particular had to actually get a change made to the language in Act 6 in an OPR bill for a technicality. There is there's no definition of healthcare facility in Act 6, and we are not really facilities. And so it was a little confusing about whether the provisions applied to us. There is a definition. I've listed it there. And so that was included in a later bill, but as we do this, I want to make sure it gets put into this bill. That definition includes us explicitly. So it was just something, we didn't catch it till folks started to try to use the provision. Jessa, do you want to say anything there on these two?
I think you've covered it, Jill. The only thing I'll add is I just want to be clear, because as Lauren testified initially, and actually I'll pause, sorry for not, Jessa Barnard with the Vermont Medical Society. Thank you for allowing us to tag team this morning. As Lauren mentioned initially, there are really three provisions, the telehealth, the medical reserve corps, and the on staff at a facility. I think there's agreement between OPR and the coalition folks that for the medical reserve corps, that should be extended to the March 31st, 2023, as with the other provisions we're recommending. And then it's the definition for sort of a length of temporary length of time would be for those who are on the staff of a licensed facility or FQHC. So just to be clear, kind of what we're talking about with those three provisions. And then the telehealth would be replaced by the Act 21.
Yeah.
Thanks, Jill.
Yeah. I think the only other thing that I had highlighted was that there's one provision on, let's see, on there's a telehealth provision that says to the extent permitted by federal law, we think you could instead of putting in a date, change that until the end of the federal public health emergency. And then there's another one that expired with the state public health emergency, the informed consent. And so everybody's already implemented. So we're not asking for flexibility there because everybody's already had to come into full compliance, given the way that was worded. I think that's the big picture. And I think I'll pause there for questions.
Why don't you take your screen down and then we can
sure.
see everyone? That'd be great. And we'll just take a couple of questions because we're crunching up on our time frame. So Representative Peterson.
Yes, thank you, Chair. Just a question or a comment, I guess. I guess the question is, are all of you folks tracking any negatives to these changes? If there's problems or you're finding that reducing regulations is causing an issue to develop or exposure of the state to lawsuit by reducing these numbers. It seems to me, and in general comment, and I'm apologize, I'm not a healthcare professional, have never worked in the industry. It seems like a lot of these things, if we find that there's not problems with them, there's not, there's good service delivered to the patient, there's not an overt or high cost of them, that some of these things can be adopted permanently. It just a thought came to my head. We see reduction in some of the regulation. And I'm looking for Lauren on here, but Lauren talked about some of that. It would seem that some of these things can be adopted permanently, and but we won't know unless you tell us, well, geez, there's specific problems with this. We've had patients complain about that. It just, maybe I'm rambling, but just a comment. Thank you.
Okay, I think your comment is well taken, and that is what you're suggesting is what our committees can deliberate as we take further testimony. So I won't open it up for discussion at this point, simply because it's going to happen once we get back to our own committees. Representative Black.
Thank you. So sort of along the same lines as Representative Peterson, I'm thinking are we extending these provisions because they're just convenient for us at the time right now? So we'd like to extend them another year, or do we see value in making things permanent? And I'm specifically, I'm talking about the sort of temporary licensure and also the prescriptions. I actually am a little concerned about that. I'm wondering, rather than making date certains that there are waivers on these, why we're not talking about making individual waivers. I mean, you can offer a provisional license to somebody, but have that individual's provisional license have a term date rather than us just coming back every single year and saying, okay, well, we're going to give you another year to keep offering this.
These are,
that would
again,
address the-
Representative Black, I think this is an excellent question to ask. And as committees get into the discussion mode and decision-making mode, decisions around waivers versus date certain will become great conversations. It's well taken.
Can I just jump here and say that Senator Lyons and I have had some preliminary discussions, but we have not made a final decision. But one of our committees will probably take the lead on trying to move a bill first. And when we do that, or we may come up with a different way to proceed. Maybe we'll do some of this jointly. We have not made that decision. Today, we're trying to put the issues on the table, get ourselves a sense of what's in front of us. And these are the questions. You're raising the questions that we need to engage with and balance all of this with the timeliness in order to allow the certainty and continuity. So we'll be making those decisions about how best to proceed. And whichever committee or jointly will need to engage the questions that you're raising.
Yep, this is great. I think that the questions you're asking will help us with our decision-making around how to proceed. This is and we may end up doing it together. I think last time the Senate took the lead and then House was working more on telehealth, and then it switched around. So
yeah,
we're all in this together.
Right. Yeah, we'll figure it out.
Okay, my suggestion, Senator Hardy, quick question.
Yeah, I guess I hear the chairs both saying that these are questions that we need to discuss, but we have witnesses right here. Can we get a sense from them what they would make permanent and what they would definitely not make permanent? I mean, it would be helpful to hear their expert opinion about it.
You know, I'd like to do that right now, but given the time that we have for telehealth, telemedicine, I think that we should allow for our witnesses to consider the question, and then they can come back to us with their testimony on that. So, they may not be prepared for that, to answer that question right now, and I'm not going to ask because we're short on time. We have 1 hour for telehealth. So it's a good point, Senator Hardy. I'm not cutting you off, but I think we need to move ahead, and we will get that information going forward. And I'm looking at Lauren and Jessa and Jill and asking for that going forward. All right, good. Thank you. Okay, so it is 10:53. Unless there is a question of clarification on the information that's come to us from the Star Wars Alliance, we'll take a break.
Yeah, I would just say, please scroll down to the bottom of the written testimony that Jill and Jessa provided, because it lists the members of the coalition. And I think it's important for us to have that in mind, that they are here today on behalf of a broader coalition of providers. So please do note who all is involved here, and appreciate their willingness to represent the group rather than to have us hear from every member of the group in terms of time frame.
That has been so critical and so appreciated.
Yeah.
Okay, we will take a break until 11, and we'll start again at 11. So